Undescended Testes in Under 5 Minutes, a short tutorial for Discover Pediatric Surgery by Andrew Grieve, Karen Milford and Nirav Patel. An undescended testicle is any testicle that does not remain in the scrotum without undue tension in a male child with a corrected gestational age of greater than 3 months. Undescended testes occur in about 1% of the male population, and the main risk factors are prematurity, congenital abdominal wall disorders, intersex disorders, posterior urethral valves, and prune belly syndrome. Testicles undergo 2 phases of descent in intrauterine life: the abdominal phase between 7 and 10 weeks, and the inguinoscrotal phase between 28 weeks and 35 weeks of gestation. The diagnosis of undescended testes is entirely clinical. Patients should be examined in a warm room, be comfortable, and in the supine position. You can use a lubricating agent to help to milk the testes into the scrotum in the normal line of descent. Most undescended testes are palpable and found below the external ring, though some may be impalpable. Normal testes are found resting in the scrotum without any tension. Retractile testes, on the other hand, are found in the groin but can be milked into the scrotum and remain there without undue tension. Retractile testes are the result of an overactive cremasteric reflex and usually do not require surgical management. 90% of undescended testes are palpable. These true palpable undescended testes cannot be milked into the scrotum and can be thought of as inguinal, suprascrotal, or ectopic. Patients with true palpable undescended testes require open orchidopexy. Impalpable undescended testes are either intra-abdominal or absent and require diagnostic laparoscopy followed by staged or unstaged laparoscopic orchidopexy, and in some rare cases even orchidectomy. Ultrasound is not a useful investigation and can result in unnecessary delays in the diagnosis of undescended testes and in fact increase in the cost of treatment. In the case of undescended testicles, testicular malposition can result in decreased spermatogenesis, decreased endocrine function, increased risk of testicular torsion and trauma, increased risk of undetected testicular malignancy, and increased risk of undetected inguinal hernia. Remember to assure parents of patients with an undescended testicle that in the case of unilateral undescended testes, fertility is not impacted. Orchidopexy should usually be performed for 18 months of age and is usually a day case procedure. Post-operatively, children can resume normal activity after 3 to 4 days, and for those undergoing open orchidopexy, parents can expect to see a scar in the scrotum and the groin on the affected side. For those undergoing a laparoscopic procedure, parents are likely to notice a scar in the scrotum and under the belly button. The risks of surgery may be thought of as major and minor. Minor risks include pain and scarring, whilst major risks include bleeding, wound infection, injury to the vas, testicular atrophy, and recurrence of the undescended testes. Always remember to counsel parents that the risks of surgery are less than the lifetime risk of injury to the testes if no intervention is taken, and thus surgical intervention is warranted. When discussing orchidopexy with parents, remember to counsel them on routine post-operative care, including to keep wounds clean and dry, to apply a topical antibiotic ointment to the scrotal wound, and to remove all dressings after 3 to 4 days. If parents notice any danger signs including bleeding, discharge from the wound, excessive pain and swelling, or even fever or vomiting in the post-operative period, they should be advised to immediately return to the hospital for review. If no danger signs are noted, routine follow-up usually occurs at 1 and 6 months post-operatively in order to assess testicular size and position. Thanks for listening, and please visit the Surgeons for Little Lives website to download and share these and similar videos for free. Thank you.